Hi, Simon, doctor at Preston Family Medical, talking about ingrown toenails after I just performed a ingrown toenail wedge excision called a ZADX procedure for a patient this week, and it just jogged my memory to talk about this health topic. So, there's things we can do to prevent ingrown toenails, there's things we can do to improve them if they're starting to go wrong, and there's things we can do if they're really wrong and we are heading for surgery. An important thing to say is that toenails are different to fingernails, and we need to cut them flat, so nice and straight, as shown on this picture, put out by John Murtagh, a famous Australian GP and GP educator. Toenails really do better if we're cutting them straight across. We're giving room for the corners of the toenail to grow out away from that soft, delicate skin alongside the nail. We want shoes that have an adequate toe box where there's plenty of room for the toe in there. It's not getting squashed and pinched by sharp, pointy toes. We want to keep the feet clean, dry. We want to give the shoes and the feet time to breathe at times. Things you can do to self if you're starting to feel a pinch there is actually every night pushing down, grabbing your thumbs and pushing down on the soft part of the toenail but against the nail, and pushing that tissue down away from the nail, allowing that corner of the nail to pop up free of the skin fold. As on this picture, if we're starting to get mild ingrown toenails, we can stop them getting worse by supporting the edge of the nail with a little wisp of cotton under the nail or a soft plastic tube. Here I use a cut bit of a butterfly needle which is nice and soft. The inside of biros apparently can be used. It's a bit of a stiffer plastic, and you can cut them with a hot paper clip, and it just needs to be held in place with a drop of super glue, just standard hardware store super glue, nothing fancy, and that just supports that broken corner of the toenail and lifts it up away from the irritated skin around the nail. If we're trying all these things, it's really not winning. It could be time for a surgical fix. I always try and talk patients out of it and try all these other things first before we get to surgery, because unfortunately it is painful and it's not comfortable for you, but for some people it really is the fix. And I'll talk about the two main options now. So here's a lovely toenail, all this infected material here on the side. After numbing the toe, and we do that by injecting some local anaesthetic at the base of the toe to make sure the toe is the whole toe is nice and numb. A traditional wedge excision removes, as the name suggests, a wedge. And what's removed is all this infected, inflamed skin. That's where the name the wedge comes from, as well as a portion of the infected nail. And that is all removed. So this is the traditional or wedge procedure called a ZADX excision. Part of the actual growing part of the nail, called the germinal matrix, is removed in that procedure as well, and as a result you do end up with a slightly narrower big toe. The traditional ZADX procedure tends to be a very good fix for difficult ingrown toenails, and particularly if there's an abnormality in the nail itself and it's not going to grow out on its own. After removing the wedge, removing this part of the growing nail, a couple of stitches to close up, a dressing, and we touch base again after loading you up with some pain relief. The other procedure targets not so much removing the nail itself, but all this excess infected, inflamed tissue, and it's sometimes called a procedure that targets overgrown toe skin, and that's the Van den Bos procedure. Again, after numbing the toe with local anaesthetic, there's a removal of the infected, inflamed toe tissue, but the nail itself is not thinned down or removed. And by removing all this excess tissue, it allows this broken, fragile edge of the nail to start growing out and grow clear of the nail again. So can be an option where the nail itself is actually intact, but the trouble is all this excess infected, inflamed, overgrown toe tissue. Recovery is similar, dressings and follow-up to make sure things stay well. So thanks for listening to that discussion about ingrown toenails. Always happy to talk about options here at Preston Family Medical. We've got other videos about various health topics on the YouTube and the website as well. And if you've got any suggestions for other videos, just add them to the Facebook group. Thanks very much for listening today.